My name is Dr. Jon Saunders, and in this video, I'm going to show you how to correct a high hip, an unlevel pelvis in the comfort of your home. Stay tuned. Thanks for tuning in again. If you're new to my channel and you'd like to get information that you can apply in the comfort of your home, please hit the subscribe button below and the notification bell. I love providing valuable content that you can apply right away to help yourself heal. In this video, I'm going to show you how to fix a high hip or an unlevel pelvis. So why would you want to correct an unlevel pelvis or a high hip? If we think biomechanically, it's simple mechanics. If we put more pressure through one side, you could have pain right from your ankle to your knee, to your hip, to your lower back, all the way up to your mid-back, neck pain, and even headaches can be caused from an unbalanced pelvis. In order to be able to fix a high hip or an unlevel pelvis, you first have to determine which side is high versus which side is low. So I'm going to show you how to do that very quickly. If you look at yourself in the mirror, it's quite easy to see, but if you don't have a mirror, just take your hands, pull them into your pelvis, and you're going to kind of place them, and you just get a feel, and you kind of have to look where your pelvis is. For me, oftentimes, my right pelvis sits a bit higher due to my work. I'm chronically hunched over people all day long, and I tend to bend to the right side. So for me, my right pelvis is typically high. For you, it might be your right, it might be your left, but check it out in the mirror, put your hands here, and you'll be able to determine that very quickly. A couple quick tips to help determine which pelvis might be high or low. Oftentimes, your dominant hand side will be the hip that's high. Not always, but often. For ladies, if you are carrying an infant or you carried your children on one hip, that might be where you look first. For the men, those that wear a wallet in their back pocket when they sit down and it shifts up, so what side you wear your wallet in might give you an indication as to what side might be high for you. I do want to take a moment to tell you this. For some of you with known conditions, it might not be possible to fix that pelvis without professional help. An example would be someone that has scoliosis, or someone that has a structurally short leg because maybe they fractured it during a growth phase. These types of patients need professional help. They need a little bit extra help than I'm going to show you in this video. Once you've determined what pelvis or what hip is high, I'm going to show you how to fix that right now. The very first thing we're going to do is we're going to stretch out the QL, the muscle between the lower ribs and the upper part of the pelvis. So whatever side your pelvis is high on, that is the side you're going to stretch. So what we're going to do, we're going to take the high side, we're going to place the leg behind the other leg on the other side. We're going to push our pelvis out to open this space up, and we're going to reach over, really opening up this side. You're going to hold this stretch for 20 to 30 seconds, and you can do 2 to 3 reps of that stretch. The next way I'm going to show you to balance out your pelvis or reduce a high hip is a leg lift. This is a little bit more challenging because it takes some concentration. I recommend you wear a pair of shoes or flip-flops. Kick the opposite side off because we're going to work this into an exercise. So it makes you a little bit unbalanced, but what you want to do, you want to come up on this side, and you want to actually just to start to activate the opposite QL. So we want to bring this side closer together as we step up, and then we can come off the foot when we get into that position and hold this. This is going to be hard if you have a high pelvis on one side. We're going to laterally flex the opposite way, and then we're going to lift our leg up, elongating this, firing our gluteal muscles, our TFL. Again, if you need a pole or a wall, do that. You're going to really feel that in here. You're going to hold this for 10 to 15 seconds, and you're going to come down again. Again, kick the shoe off. You're going to come up on your toe as you fire the opposite side, and you're going to lift the foot off the ground. And again, if you need balance, that's completely okay. You're going to really feel that in the hip, in the glutes, and even in the lower back. One last time, come up on your toe, and as you're coming up on your toe, you're going to activate the opposite side. So you're going to squeeze your pelvis and rib cage together, and as you come up, you're going to lift that foot up. Again, you're going to really start to feel that. Hold it for 10 to 15 seconds. For some of you, you might only be able to hold this for a few seconds. You can rep it out as well, and so you can really just kind of really hold the rep if you can't balance, and you can knock off 10 to 15 reps for 2 to 3 sets. But I really want you to work up to the balance. It's really good to help reset your pelvis. For this next exercise, we've all done this. The key for this one is only doing it on one side. We're gonna do the side plank on the short side or the low hip side. And so it's very simple. We're gonna get into a side plank position. For some of you, you can do it off of your knee, but the best, most effective way is to do a normal side plank. So what we're doing is we're contracting the opposite side of the high side, and it's gonna pull our rib cage and our pelvis together. 3 sets, 30-second holds, and then relax. I really want you to do the QL stretch, and then the leg lift, and then the plank in that order. And finally, I'm gonna end with a bonus self-adjustment for your pelvis or a resetting of your pelvis. And we're gonna do this in 2 movements. The first thing we're gonna do is get on our back, and we're gonna bring up our legs about 90 degrees. We're gonna take one hand on the back of our thigh, the other hand on the front of the opposite leg, and we're just gonna isometrically contract. So this knee's coming up, this knee's going down. We're doing this movement, but we're isometrically contracting for 5, 4, 3, 2, 1, and the opposite, 5, 4, 3, 2, 1. And then immediately we're gonna take our fists, put them inside our knees, and we're gonna take our knees and pull them together. We're gonna slowly ramp up the force though. It's not a fast one, just slowly ramp it up and hold for 5 seconds. I just got a really good release in my pelvis. And then relax, and again, we're gonna do the same thing, opposite, 5, 4, 3, 2, 1, 5, 4, 3, 2, 1. And again, ramp up the force for 5 seconds and release. I know if you apply that routine, it'll help balance your pelvis, at least between your chiropractic appointments. And if you can't get to your chiropractor, at least you have something to do in the comfort of your home. If you like the content, please give me the thumbs up. And if you have a question, leave it in the comments below. I love answering all your questions, and we'll try to get to every single one of them. And again, if you're new to the channel, I'd appreciate if you hit the subscribe button below so you can be informed when I upload a new video. Thanks for watching, and I can't wait to see you on my next video. Stay well.